when we talk about health policy, it's certainly been at the front of the national conversation. And then we watched Congress struggle unsuccessfully to pass legislation to reform the national health system.
There's also a real conversation, a much more philosophical conversation going on about the role of states in healthcare and what that should look like going forward.
I think the fundamental question that everyone should have some health care is largely been addressed, and I believe that we are on a path to working toward that goal in a way that we never did before.
Reducing the rate of uninsured to about 7%. Half of that 7% are undocumented, which means we've reduced the rate of what I might call the eligible uninsured to about 3.5%. That is phenomenal.
The problem is we've got healthy people paying for sick people. That is the fundamental principle of insurance. And we have an insurance concept. You don't have an auto accident to use your auto insurance. You don't want your house to burn down to use your homeowner's insurance. But everyone's going to use their health insurance. So it's a hybrid from a market standpoint or an economic standpoint. It's partly insurance for catastrophic, but it's also a prepaid plan. It's something that you expect to use and you want to use. And so how do you regulate that and manage it with a mixed understanding in the body politic of what it is, what the actual product is?
That healthcare spending is highly concentrated. So the top 1% of spenders account for 20% of spending. So basically what this means in terms of a policy solution is if you can figure out who those 1% are, and if you can control their costs, you can make a huge difference in healthcare costs.